Hello and welcome to this Instagram Live. I'm Dr Vicky O Dwyer. I'm a consultant obstetrician at the Rotunda Hospital. This Instagram Live is part of the Rotunda Hospital's Early Pregnancy Information Week. So I'm going to be answering some of your questions on pregnancy sickness and hyperemesis gravidarum. So for those of you that have just joined, about 80% of women will have some nausea and maybe mild vomiting in the first trimester of pregnancy. But hyperemesis gravidarum is different, so that affects 3% of women. It's a severe form of pregnancy sickness that is associated with weight loss, dehydration and electrolyte imbalances. So I'm going to cover both. So let's get to it. I'm going to answer some of your questions that you submitted earlier this week. So the first one is lack of sickness a sign that my baby is not growing? I do get asked this a fair bit. You may find that your sickness comes and goes. So certainly when someone comes in to me and they say, look, I don't feel well, I have nausea, that in some ways is reassuring because it means there's lots of pregnancy hormone there. But every pregnancy is different. So there are some lucky people who have no nausea and everything is absolutely fine. And if you have days when your sickness disappears and then it may come back, please don't panic. It normally peaks around the 9-week mark, 10 weeks. And then if it's normal pregnancy sickness, will improve and disappear by the end of the first trimester. Is there anything I can do to ease sickness in the first trimester? And when, if ever, do I need to see a doctor about it? So the first thing is lifestyle changes and dietary changes can help with mild symptoms. Main thing is to keep hydrated, whether that's water, 7-Up, juice, what works for you best. When I was pregnant, I found jellies actually really helpful for nausea and to avoid cooking because the smells can trigger you. So just keeping the foods really plain and simple. If that's toast, that's totally fine. You actually don't need a huge amount of extra nutritional value in the first trimester. And one of our dietitians is going to cover nutrition later on in the week, so definitely tune in for that. In terms of what you can do if that's not working, so the main thing is if you're getting dehydrated, you're not keeping down fluids, that's when you need to see a doctor. If it's interfering with your daily life, so if you can't bring other kids to school, if you can't get out to work, if you're really getting down on yourself, and there is a psychological effect, particularly with hyperemesis, and I recommend hyperemesis.ie for anyone that's affected. They have a great support group and lots of information on their website. Next question was about constant bad nausea and if there was something they could take and whether they could use Motilium. So actually the nausea is due to the pregnancy hormone. Motilium we don't tend to prescribe in pregnancy. Our first line treatment is a medication called Caraban, which I'm going to talk about a little bit later on. The nausea is probably more difficult to treat than the vomiting. So avoiding prolonged periods of not eating, just eating small amounts regularly so that your stomach isn't empty can help with nausea. Could morning sickness be the result of magnesium deficiency? So again, this is probably an unlikely cause. Magnesium deficiency can definitely cause nausea, but it wouldn't be a common cause in the first trimester. Magnesium supplements we take later on in pregnancy, but in the first trimester, I guess the most important thing is your folic acid. And I often have people tell me that their multivitamin can make them feel a little bit sick. So either switch to a plain folic acid or take your multivitamin maybe later in the day when the sickness isn't so bad. This question is around supplements like Procive and that they're worried that they may not be getting enough nutrition, so around food aversions. And this is really common in early pregnancy. So you might find that you really crave cheese or you don't want to eat meat. And again, it's just taking what you can tolerate, keeping it really simple. Again, with foods in pregnancy, there are some do's and don'ts. Actually on my own Instagram page, which is Dr Vicky O Dwyer, I have a section in my highlights, one on hyperemesis, and I have another section on foods in pregnancy that you might find helpful around things that you should avoid, not just in the first trimester, but throughout pregnancy. So when is Caraban recommended? Well, Caraban is our first line treatment for hyperemesis. It's a combination of a vitamin B6 and an antihistamine called doxylamine. So the way it's taken is 1 tablet in the morning, 1 in the afternoon and 2 in the evening. And people often find it makes them feel a little bit sleepy, and that's why 2 in the evening can actually help your sleep. It should hopefully last you till the morning so that you don't wake up feeling sick. It works for both nausea and for vomiting. Second question was around safety or any risk to the baby. So Caraban's been really well studied. It was introduced about, I think, 1979 in Canada, came to Ireland a couple of years ago and absolutely revolutionised the treatment of hyperemesis. So when I was training, we'd often have people who were in hospital for days with sickness, for IV fluids and other medications. But when Caraban got introduced, it really just changed things. And what we find is if you get in there early with it, when your sickness is bad, lots of people will stay on it. So some people come off it at the end of the first trimester, but I'd have lots of patients who have hyperemesis who will stay on it right until the very end. And that is absolutely fine. And actually my own sister, who was tormented by sickness and pregnancy, said that once she had her baby, it was like flipping a switch and the sickness was gone. So you may need it right up until the end. If you're taking it, you really need to wean it slowly if you're feeling better. So I'd say have a week of no sickness, then think about dropping 1 tablet maybe every 2 to 3 days. If you stop it suddenly, you can get a rebound sickness. So you want to gradually come off it. Some people will go back on it. Some people get down to 2 tablets a day, and other people will be on the 4 tablets till the end. So the next question was around other treatments that can help with sickness and pregnancy. So for some people, Caraban may not work, or it may not be enough, or it may not be the right treatment. So if you have someone who has vomiting maybe 1 or 2 days a week, and you don't want to have to take a medication all the time, because with Caraban, you can't just take it when you don't feel well. You have to take it consistently to get the benefit from it. So the other medications we use would be Stemetil, which is either in a tablet form or an injection. And that's when you just take when you need it. Works really well for vomiting. And we would often give that in our daycare unit or in our emergency department to help with sickness. The other one we use is Zofran. Again, comes in an intravenous form or in a tablet form. And it's a really good treatment for sickness and pregnancy. The aim is to get you feeling well, to get you rehydrated and back to being able to do everything you'd normally do and to try and enjoy pregnancy, because it can be really hard if the nausea or the vomiting is persistent. Some people will also need vitamin supplementation through intravenous, the intravenous route. We call it Pabrinex. And if you've got hyperemesis, you've probably been in our day ward in the Rotunda on a combination of IV fluids and Pabrinex. The other thing to watch out for is blood clots. So pregnancy will increase your clotting risk, so getting a clot in your leg or your lung, and dehydration can increase that further. So maybe recommended that you take heparin injections for part of your pregnancy while you're sick. Next question. So this girl said she's 8 weeks pregnant, put on Caraban, still has nausea, only on it 2 days, and does it always work? I would say it works for most people. It doesn't work for everyone. She's also asked about claiming it back. So this is a slightly difficult one. The Caraban scheme involves this form, which I'm going to hold up so you guys can see it. This has to be filled by a consultant obstetrician. And it says that you need Caraban and it should be reimbursed. So it's emailed centrally, and then the central office within the HSE notifies your nominated pharmacy. So if you have a medical card and you have this form filled, you can get Caraban for free. If you have a drug payment scheme card, and everybody can get one of these in their pharmacy, then it's €80 a month, and that covers all your medications for that month. I'm hoping this will change. A lot of GPs prescribe Caraban before we even meet women in pregnancy, and I'm hoping that they're going to change this soon, because any doctor should be able to prescribe it who's providing combined antenatal care. If you're really struggling, you can come to our emergency department, and we often prescribe it through there as well, and the form can be filled by one of our consultants. Next question is diagnosed with hyperemesis, expecting twins in early October, so that's very exciting and congratulations. Is it likely the symptoms will ease after the first trimester? So hyperemesis or nausea, vomiting can be worse with twin pregnancy. Hard to know whether it will settle. It absolutely could. You'll really only know once you get there. One of the things we do when someone has hyperemesis actually is do an ultrasound to check and see, is it a multiple pregnancy? So wishing you the best in your pregnancy, and yes, hopefully the symptoms will settle after the first trimester. Next question is around recurrence. So if you've had hyperemesis in a previous pregnancy, how likely is it again? If you have pregnancy sickness, that can absolutely vary in different pregnancies. Whereas if you've been diagnosed with hyperemesis, unfortunately that tends to recur. We don't know why some women get hyperemesis. So we know that pregnancy sickness is related to the pregnancy hormone HCG, but some people are more prone to get the severe form. And it does run in families. So we see, if your mum had it, you're a little bit more likely to have it. And unfortunately, if you've had it in one pregnancy, you'll probably get it the next time. So really get in there early with the medications, get linked with your hospital, get linked in with a dietitian. And we've got some super dietitians in the Rotunda, and one of whom who's going to be talking to you later in the week. Psychological support as well. And we have a great perinatal mental health team in the Rotunda that offers psychological support for women with severe pregnancy sickness. If you've had very bad morning sickness for all of the first trimester, and then we're diagnosed with hyperemesis, which doesn't just affect the morning. So hyperemesis can be all day, all night. It is not morning sickness, it's pregnancy sickness. And it starts to ease at 12 weeks. Is there a chance that it can come back? So I do see this sometimes, that the sickness will improve after the first trimester, and then at the end of pregnancy can come back a bit. And that is something that happens with hyperemesis. The other thing you might find is that you start to get heartburn, and that definitely gets worse at the end of pregnancy. So think about it, your bump is pushing up on your stomach emptying is slowing down in pregnancy. So we'd often prescribe omeprazole, which reduces the acid in your stomach. Really great, particularly if you've tried Gaviscon, or some people say they've tried Rennies, but omeprazole would be the one that we would use most commonly in pregnancy for heartburn. It can be taken with other medication like Caraban or Stemetil, as they're all slightly different and can be safely taken together. Is it known whether hyperemesis happens because of the father's genetics? Not that I know of. I know it runs in families, and it can be, there can be a genetic link, but we don't exactly know why it happens. But I'm not aware that it's to do with father's genetics. I'm just looking, I think there might have been a question come through there now. So someone sharing their experience, thank you so much for sharing it. It says, mine didn't ease at all. I had it from the moment I got pregnant till the moment my baby was born, and it was awful. And it really is. So I'm so sorry to hear that you had it for the whole pregnancy. We do often see it kicks in around the 6-week mark as your pregnancy hormone starts to rise. And that's often one of the first reasons people know they're pregnant, because they just don't feel well. Just going to have a look through. Lots of people waving at me, so waving back. And thank you all so much for joining and for submitting your questions. I think I have covered all the questions so far. If anyone has any other questions they want to pop up, please feel free to ask. And remember to join in the rest of the week for more information on early pregnancy. Also check out my Instagram, it's Dr Vicky O Dwyer. I'm going to share some more information there all around early pregnancy and sickness and hyperemesis. And I'm going to save this, or try and save this, to the Rotunda Instagram so that you guys can all look back. Take care, wishing you the best in your pregnancy.